Okay, I'm Catherine Bushnell. I'm from McGill University in Montreal, Canada. I also was looking forward to come down and have some nice sunny weather, but at least you don't have snow, which is a good thing. But I'm the director of the Alan Edwards Center for Research on Pain at McGill University, and I am actually a psychologist by training and had postdoctoral training in neurophysiology. So I'm not a rheumatologist. And can you go ahead and go to my slides? And I'll be talking to you today about fibromyalgia, which is an unusual, it's very different than any other, quote, rheumatological disease, probably because it isn't a rheumatological disease. But you get fibromyalgia patients who come to you, right? So I'm going to tell you a little bit about, I study chronic pain in general. I'm going to talk to you about how fibromyalgia is similar to other chronic pain diseases and tell you a little bit about what pain researchers believe are the mechanisms underlying some of the causes of fibromyalgia, or at least some of the mechanisms that drive the pain of fibromyalgia. Okay, I'm going to be talking a lot about brain imaging today, and I guess I'll give you a kind of a basic lecture on the brain mechanisms underlying pain in general. And brain imaging is a wonderful tool for us to be able to study the basis of pain perception, because people come in and they say they have pain, they look fine, you think they're crazy, but we can actually look at what's happening in their brain when they say they have pain. And it turns out that most chronic pain patients, when they say they have pain and they say it feels like somebody is stabbing me, but they're just sitting there, in fact, what we're seeing in their brain is similar to what you would see if somebody were, stabbing needles into their arms. So there's a disconnect between the way patients present to you and what they say, and this allows us to be able to look at that disconnect. As I said, it's a particularly important technique for examining the neural changes related to chronic pain states. So some of the techniques that I will be referring to today are MRI. I'm going to be talking about both anatomical MRI of the brain and also functional MRI, where we can actually look at changes in hemodynamic parameters that reflect blood flow, which we consider an indirect measure of neuronal activity in the brain. So when a part of the brain is activated, you get increased blood flow to that part of the brain, and we can see this with our blood oxygen level dependent, the bold signal, where we can see changes